So we have here a 47-year-old patient of mine who was nice enough to allow us to videotape her. What she wanted was an upper lid blepharoplasty and SmartLipo to the neck. So I've already made this very tiny incision. It's only 2 millimeters, and I've put a lot of local anesthetic into her neck, and her eyes have already been numbed up. These are going to be the excision points. Again, these were marked, and now I've put in some local. That's why she's so puffy. My trusty assistant's giving me counter traction, and she's completely pain-free, and she's awake. Say hello.
Hello.
Okay, there you go. So again, nothing's really hurt. I use very, very tiny needles for local anesthetic, so it shouldn't hurt at all, and it should be basically painless. If she does feel any discomfort, she just simply tells us, and we put in some more local. So it's very easy. I'm using a 15 blade to make my incision, and I do my excisions with an ophthalmic cautery. There should be very little bleeding, if any. Most patients don't bruise, but I always tell patients I can't promise them that they won't bruise. I certainly do my best to minimize it, but sometimes people bruise regardless of what you do. Any discomfort at all, or painless?
No.
Excellent. Excellent. And that's the way it really should be for everybody. It should be a completely painless procedure. Even the local going in should be very minor. So that's basically the excision. Luba, my trusty assistant, is going to give me, stay there, yeah, perfect. And then that's it's going to give me counter traction. And there's different ways of excising the skin. The technique I like to utilize is I use an ophthalmic cautery, but other people would do different ways, and that's less important than actually what you accomplish and what your marks are. Okay, I'm just going to complete this a little bit more. And what I do is I use this ophthalmic cautery because it makes it very dry field. And I'm just basically excising a skin muscle flap. See, there's basically no bleeding with this technique. Get her turn her head. I'm short, so I just have to have my patient head perfect. Thanks. When I do these, they typically take an hour from when I start to finish. Sometimes a little bit less. A lot of it's just really waiting for the local to come in. Obviously each person's different, each one, so, but in general it's an hour. They should really have little to no pain. I let everybody shower, wash their hair the next day. They're up walking immediately. I usually like them to take the next day off and ice it, and then they can go back to work really the second day. The only reason why they're staying home the first day is simply so they can apply lots of ice to it. When they sleep, I like them to sleep with about 4 or 5 pillows under their heads, just simply because you get less swelling if you don't allow gravity to get in the way. Sometimes people have a little fat pad. She doesn't have one that I need to excise, but some people do. So again, perfect. Excellent, just stay like that. Good stuff. Perfect. So what we've done now is we've excised the skin. You can see there's really no bleeding whatsoever. And what I'm going to do in a second is just double check, put a little pressure in there. Give it a look. Yep, perfect. One little spot I want to dry off, and with a bit of luck she'll have absolutely no bruising. Sometimes though, even just putting a suture in just to close everything up will cause a little bruise. So. But I don't worry too much about bruising. It goes away. You're doing excellent.
I don't feel anything.
Great. So again, she's completely awake. I would give all my blepharoplasties a little bit of Ativan beforehand. Just relaxes them. You can let go now. My hand's perfect. So when I do my suture, and again, there's different techniques different surgeons have. I don't tie knots on either end. When I'm done at the end of the procedure, Luba, my trusty assistant, will apply a stair strip on each side, and the suture typically will come out 6 days later, and it just slides out effortlessly in the office. There's obviously still some swelling, but usually not very much. But like every cosmetic procedure, with time it just keeps getting better and better. I'm doing what's called a subcuticular suture, which means there's no suture marks, it's all slid underneath the skin. And you can see it's quite a rapid suture. The other side, of course, will be done exactly the same nice result, but once I finish the suture, I'll show it to you, and then the other side will be done, as I said, the same. I've already marked her. And the reason why I inject the neck ahead of time is it gives it a little chance to get completely numb, but the epinephrine. The reason why she looks a little bit white is the epinephrine stops the bleeding, or most of the bleeding, which is why I'm able to do this. Why it's so different than if you cut your face, for example, shaving when there's lots of blood. Here there's, as you can see, essentially no blood. Plastic surgeons are very fussy surgeons. We always like extremely dry fields so we can see exactly what we're doing and have very meticulous work as a rule. Okay, dry a little bit over here. Perfect, thank you very much. See the suture's just sliding through, it's not hurting her. And when I go to take that, it'll be this easy. So just leave a little bit. And we'll trim that at the very end. And that's basically it. You can see it's a nice closure, and it's very normal to have just that tiny couple of millimeters of her eye being open. That'll close, but you can see how nice it'll look. The scar will be basically invisible very, very quickly.